This video is on pneumonia. Typical pneumonia is an infection that leads to inflammation and the filling of the alveoli with fluid, so a gas exchange occurs. Broadly speaking, this requires inhaling the organism and then the invasion of the lung parenchyma, or lung tissue, and the associated host inflammatory response. Remember, alveoli is the air sac at the end of the bronchiole or airway. The neutrophil response leading to suppurative inflammation in the alveoli leads to many symptoms such as dyspnea that we will cover later. Common causative organisms include Streptococcus pneumonia, Staphylococcus aureus, and Haemophilus influenza. Atypical pneumonia organisms include Mycoplasma pneumonia in a younger population, and Chlamydia pneumonia and Legionella pneumonia in an older population. The body has defenses to stop these infections, and it pretty much follows the respiratory tract. So the first line is the mouth and nose, where humidification occurs. Then the gag and cough reflex, mediated by the crania in the trachea. Then mucociliary apparatus, and at the bronchus there's also associated lymphoid tissue that produces IgA, and complements to ospinized bacteria and alveolar macrophages that destroy bacteria. So pneumonia results when these lung defenses are impaired from several factors. These include extremities of age, so old or young patients, suppressed cough and gag reflex from impaired consciousness. There may be impaired drainage of secretions, such as from cystic fibrosis, bronchiectasis, obstructive neoplasm, or a foreign body. The mucociliary apparatus itself can be impaired, such as from cigarette smoke. Finally, congestive cardiac failure or terminal cancer can cause static fluid in the alveoli, which is also a risk factor. So that is what's going on behind the scenes. How would a patient with pneumonia present? Well, they present with typical cold-like symptoms, so a productive cough due to the fibrinous suppurative exudate filling the alveoli. The patient would produce mucus to try to cough up the infection from the alveoli and then spit it out or swallow it so it gets killed in the stomach. However, it's important to note as atypical pneumonia impacts the alveolar septa or bronchus, it would not present with a productive cough because the alveoli is not filling with pus. Patients may be short of breath because consolidation of the alveoli impairs gas exchange if you look at this diagram. And this leads to a ventilation perfusion mismatch and therefore hypoxemia. Pleuritic chest pain would also result from the inflamed visceral pleura rubbing against the parietal pleura. Finally, the systemic impact of inflammatory cytokines such as TNF-alpha and interleukin-1 results in chills and rigors or fevers through resetting of the hypothalamic set point. On examination, you would elicit signs such as tachypnea due to the peripheral chemoreceptor-mediated response to hypoxemia, which, as discussed before, is a result of the consolidation. And we talked about chills and fevers, and also auscultation could yield crepitations, which are indicative of pus-filled alveoli popping open with breathing. Pleural rub may be heard if the layers of the pleura are rubbing against each other with fibrinous pleurisy. Investigations, as usual, would start with bloods, looking for neutrophilic leukocytosis, and also, as usual, check for inflammatory markers such as CRP, and you can also do ESR. ABGs would reveal the discussed hypoxemia. If there's sputum, it should be stained, cultured, and tested for antibiotics. Sensitivities, because this will tell you which antibiotics will be effective in treating your specific infection. Imaging will include a chest X-ray that reveals consolidation with air bronchograms. If pneumonia progresses, it can lead to complications which may be fatal. So the outdated acronym that's used is SLAPHR, and it stands for sepsis, lung abscess, ARDS, or acute respiratory distress syndrome, parapneumonic effusion, so pleural effusion around the pleural space adjacent to the pneumonia, hypotension, empyema, and respiratory or renal failure. Thank you for watching. If you learned something or found it useful, or just want to make my mum happy, Please like and subscribe and drop a comment with any questions or any topics you want to see in the future.